Welcome back. March marks Colon Cancer Awareness Month, and with it comes the importance of making sure people are getting their screenings.
Here to talk more about colon cancer and why it's valuable to be proactive in cancer testing is Dr. Brian Curtis. Good morning, Dr. Curtis.
Hey.
How are you?
Yeah, I'm good. Good morning.
Good morning.
So first, Dr. Curtis, how dangerous is colon cancer for men and women?
Yeah, so colon cancer is the second leading cause of cancer deaths for both men and women. Lung cancer is the first and colon cancer is the second. However, it's also one of the most easy cancers to diagnose early and prevent cancer.
Well, let's talk about an easy way to get tested. What is the most common way for people to get a test?
Yeah, so the gold standard would be the colonoscopy that you hear about, which is basically they take a tube and about the size of my pinky and they look through your entire colon looking for any polyps, and if there's polyps there, they will remove them. And there's any suspicious lesions, they'll take a biopsy of them. The other, probably the second way that you should do it is what's called Cologuard, which if you've been watching any of the NCAA tournament, I think it's about every third commercial. And so that's actually a stool test that you actually mail into the company. And what it looks for is DNA for atypical cells, precancerous or cancerous cells, but it's not as accurate as a colonoscopy.
Gotcha.
And obviously, on the topic of the colonoscopy, do you have any advice for those people out there who may be scared to get one?
Yeah, you know, I think a lot of people build it up, and then when you get, like when they're done, they're like, it wasn't that bad. And so really what happens with the colonoscopy is the day before you kind of go on a clear liquid diet, and then probably in the evening you start taking a medicine that actually helps clear your colon, so you end up spending a lot of time on the toilet. But that's in order to clean your colon out completely. So when they look in there with the scope, they can look for any polyps. Now, some polyps are actually flat, and so a lot of people think polyps like mushrooms and stuff like that, but some of them are very flat. That can be hard to see if there's actually stool in your colon. But when you go in, they give you an IV, and then they give you some medicine, and they give you sedation. So you basically go to sleep, and then you just wake up back in the recovery area with whoever's going to drive you home. And that's really about all you remember of the entire procedure.
Yeah. Well, you just mentioned polyps. What are they?
So polyps are really a growth of atypical cells. And so it's almost like, and there's different kinds of polyps that are in your colon. But a lot of them become precancerous. And so the reason we want to do the colonoscopy is to get them all out of there. And so if we remove them, we remove a precancerous lesion, so then you don't have to worry about it. And then depending on how many polyps we find or how many are there will determine when you need a repeat colonoscopy. But they're just really a growth of atypical cells.
And there doesn't seem to be like an age for when people can say, oh, I might get colon cancer. So when should people get a colon screening? Yeah,
so for an average risk person, somebody that doesn't have other risks, so an average risk person, we recently lowered the guidelines to 45 years. And so it used to be 50, now it's 45. And the reason we lowered it was we were actually seeing an increased incidence of colon cancer in people in the late 40s. And that was really because we were doing a good job of screening everybody over the age of 50. And so really we started detecting a little bit more prior to 50. So anybody over the age of 45 or 45 and more, really you need to be screened for colon cancer.
Right, and are there any symptoms that people should be aware of to get an early screening?
Yeah, you know, so really a screening is for somebody that really doesn't have symptoms. And so and a lot of colon cancer is very silent, and so you can have a screening colonoscopy and find it and have no symptoms. But people that have blood in their stools or have a change in their stool pattern really should be seeing their doctor and considering getting a colonoscopy. At that time, it would no longer really be a screening. It turns into more of a diagnostic that we're actually looking for a cause, not just looking to prevent. And that's the difference between a diagnostic and a screen.
Right. Well, Dr. Curtis, thank you so much for joining us this morning.
Yes. Happy rainy Wednesday, almost Saturday.
Yes.
Yes.
Thank you for your positivity today.
All right. We will share this interview on our website, ciproud.com, and we'll be right back.